Since January 2020, the COVID-19 virus and its variants have killed more than 600,000 people in the US alone.
More than 20,000 of those deaths occurred in the state of Georgia and include members of the Columbus State University family.
While more than 3/4 of COVID-19 deaths have affected people over the age of 65, no age group has been spared from the effects of the virus.
In the US, 6.4 million young adults contracted COVID-19 with more than 2,800 deaths.
That's nearly 450 deaths per million COVID cases for young adults.
Even after recovering from COVID-19, many people will continue to experience long-term health problems for months.
The number of new COVID-19 cases dramatically decreased in the spring and summer of this year, mostly because of the availability of COVID vaccines and precautionary measures such as masking.
Unfortunately, the more transmissible Delta variant is currently contributing to an increase in COVID-19 hospitalizations, even among children and young adults.
Part of that increase can be attributed to the fact that the Delta variant is almost twice as contagious as the original COVID-19 virus.
Both vaccinated and unvaccinated people can carry COVID-19, even if they have mild or no symptoms.
Because up to 80% of people don't even know they are carrying the virus, they'll inadvertently spread it to the people around them.
We now know that as much as half of all COVID-19 transmission is from this group of people.
In some cases, the people we expose to the virus will go on to contract COVID-19.
Some will experience serious health effects and may have to be hospitalized.
Others may wind up in intensive care or even die.
Fortunately, there are 3 easy ways we can reduce the spread of COVID-19 to the most vulnerable members in our community.
Wash your hands.
Wash your hands.
Wash your hands.
Soap and alcohol-based hand sanitizers remove and kill microbes such as the COVID-19 virus, making it less likely you'll pass along the virus through touch.
Number 2, wear a mask.
Wear a mask?
Wear a mask. A tight-fitting mask that covers your mouth and nose dramatically reduces the droplets we expel when we talk, cough, and sneeze.
Those infectious droplets are then less likely to transmit the virus to the people around us.
Get vaccinated.
Get vaccinated. Get vaccinated.
COVID-19 vaccines are both safe and effective.
Fewer than 1% of vaccinated people in the US have been hospitalized or died from COVID-19.
Each of the 3 vaccines authorized for emergency use by the FDA were thoroughly tested and found to be safe and effective prior to being made available to the public.
More than 346 million doses of COVID-19 vaccine have been given across the US since December 2020, with more than 4 billion doses worldwide.
The most common side effects, soreness, tiredness, fever, chills, or headache, generally last no more than 2 days.
More severe side effects, allergic reactions, blood clots, and heart inflammation are extremely rare.
Fewer than 5 of every million people vaccinated have experienced a serious side effect.
You are over 100 times more likely.
Over 100 times more likely.
Over 100 times more likely to be hospitalized, experience long-term health problems, or even die from COVID-19 than you are to have a serious side effect from the vaccine.
The last year has taken its toll on all of us.
We want to keep everybody in our lives safe.
Students,
faculty and staff,
family and friends,
even people we don't even know.
Fortunately, we now have a much better understanding of what it takes to end the pandemic.
As your professors, we're asking you to do your part.
We're asking you to do your part.
We're asking you to do your part.
Public health is a group project, not just about personal responsibilities.
Wash your hands.
Wear a mask in classrooms and around crowds.
Get vaccinated.
Get the facts and don't be misled by disinformation.
Join us.
Join us.
Join us.
Join us in keeping our community and our campus safe.
Thank you all so much. We love you. Goodbye.